Welcome to the Deep Dive. We're the place where we sift through source materials, find those key nuggets of insight, and basically give you a shortcut to being really well informed. Today, we're doing something, well, a bit different. A deep dive into a historical medical text. It's Homeopathic Materia Medica by William Boericke, MD. And we're zooming in on just one substance, Cinnabaris. Our mission, to unpack the really detailed observations Boericke documented about it.
Right, and just so you know what we're dealing with, Materia Medica like Boericke's, it's essentially a big compilation of drug knowledge from that time. Think of it like a reference book listing all the symptoms the substance was thought to help with, sort of symptom dictionary almost. And Boericke identifies Cinnabaris as mercuric sulfide, also known as Mercurius sulphuratus ruber.
Okay, so mercuric sulfide. Boericke says its main use is for, and I'm quoting here, certain forms of ciliary neuralgia, that's the severe facial pain, often around the eye, and also ulceration upon a syphilitic base. So symptoms tied to syphilis. He also links it to, interestingly, sleeplessness during the night. So, okay, how did they even catalog all this? Let's unpack it system by system.
It really is remarkable, the level of detail. If we start with the head, the text mentions things like congestion to head, and even the appearance, a face, purple, red, it's very specific visual cues.
Yeah, purple, red, that's vivid. It makes you think how closely they must have been looking. Then we get to the eyes, and the pain descriptions are incredibly granular. Boericke lists pains from the lacrimal duct to your tear duct around eye to temple, and another path from inner canthus across brows to ear, the inner corner of the eye across the eyebrow to the ear. Wow.
And it's not just surface pain. He specifies severe shooting pain in bones of orbit, even more precise, running from inner to outer canthus in the bone. That specificity is something else.
In the bone itself. And besides pain.
Well, there's redness of whole eye, granulated lids like rough or bumpy eyelids, and canthian lids red, so redness in the corners and on the lids too.
This level of anatomical detail, what does it tell us about how they were thinking? Diagnostically.
It suggests a highly empirical approach. They were observing, classifying, noting down every little thing. These exact pain pathways, this specific type of redness, these were clues for them, like building this huge database of symptoms, even without our modern tools. It was all about differentiation.
That makes sense. And the detail doesn't stop there, right? Moving to the nose.
Oh yeah, there's this really distinctive note. Oppressive sensation, as from heavy spectacles.
I can almost feel that, like something's pressing down on the bridge of your nose.
Exactly. And again, it's specific. Pain about root, extending into bones on each side. Not just general pressure.
That heavy spectacles thing, it's such a unique, subjective feeling. It really captures what these materia medicus were trying to do, doesn't it?
Absolutely. Capturing the patient's exact experience. Then in the throat, you see things like stringy mucus pass through posterior nares into throat. So mucus dripping from the back of the nose. Also dryness of mouth and throat. So bad that the person must rinse the mouth. And then this description, fiery looking ulcers in mouth and throat.
Fiery looking, that phrase really jumps out, especially when you remember that initial mention of a syphilitic base. And this is where Boericke gets really specific about the systemic effects, particularly around genitourinary symptoms. For males, he lists prepuce swollen, the foreskin, warts on it which bleed easily, testicles enlarged, buboes, those inflamed lymph nodes, usually groin area, and angry-looking chancres. Chancres are the classic primary source of syphilis, plus syphilides, squamous and vesicular skin eruptions, scaly or blistery, also typical of syphilis.
Exactly. It really drills down on that syphilitic connection.
It certainly does.
And for females, the symptoms listed are leukorrhea, which is a vaginal discharge, and a feeling of pressure in vagina. So when you put it all together, these genitourinary symptoms, along with the skin issues we'll get to, they strongly point back to that primary indication Boericke gave, syphilitic conditions. It shows they saw the disease as affecting the whole system, and Cinnabaris was thought to address that whole picture.
Right, it wasn't just one localized problem. Okay, what about the limbs, the extremities?
More unique details there too. There's pain in forearm from elbow down, including hands.
Yeah.
Fairly straightforward. But then there's this pain in long bones when barometer lowers.
When the barometer lowers?
Yeah.
Like weather-related pain?
Apparently so. Along with coldness of joints, noting a connection to barometric pressure. That's quite something for that era.
It really is. What does that suggest?
Well, it shows how closely they observed everything that might influence the patient's condition, environmental factors included. Even if they didn't have the scientific explanation, they recorded the correlation. It points towards a maybe a more holistic view, considering the patient's whole context.
Interesting. And the skin stuff you mentioned, tying back to the ulcers.
Yes, definitely. The text mentions very fiery red looking ulcers again. Also, nodes on shin bones, those hard lumps. Buboes again showing up in different contexts. And carboloma, easily bleeding, wart like growths.
So again, very consistent with the descriptions of syphilis at the time.
Exactly. A coherent pattern across multiple body systems. Which brings us to what Boericke calls modalities.
Nodalities, meaning the things that make the symptoms better or worse.
Precisely. And Cinnabaris has a really unusual one listed.
Oh.
Symptoms are reportedly worse lying on right side. Okay, position matters sometimes, but listen to this accompanying sensation as if contents of body were being dragged over to that side.
Wow. As if your insides are shifting. That is incredibly specific. How would they even pin that down?
Probably through very, very detailed questioning of the patient. How do you feel when you lie this way versus that way? This level of detail was crucial for matching the patient's unique symptoms to the right remedy profile. Boericke also includes a relationship section. This is where he compares Cinnabaris to other substances, heparin, nitric acid, thuja, sepia.
So comparing it to other known remedies.
Right. It helped practitioners tell similar remedies apart, or maybe suggest what to try next, or even what might counteract the effects. He lists heparin and sulfur as antidotes for Cinnabaris.
Okay, so context within their system. And finally, the ghosts.
He recommends the first to third trituration.
Trituration, what's that involve?
It's a specific homeopathic preparation method, especially for things that don't dissolve easily. It involves grinding the substance, Cinnabaris in this case, with lactose sugar in set ratios. First to third suggests it's relatively less dilute compared to some homeopathic preparations. A bit more material substance present, by their standards anyway. It shows the practical side, how they actually prepared and gave these things.
Okay, so we've walked through Boericke's incredibly detailed picture of Cinnabaris. What does this whole deep dive tell us about this text and maybe historical medicine more broadly?
Well, I think what stands out is that incredibly specific symptom profile for Cinnabaris, right? Especially that strong, persistent link to syphilis symptoms across the whole body. And the level of detail, the precise pain paths, the look of ulcers, those subjective feelings like the dragging sensation or the heavy spectacles. It highlights a really meticulous symptom-first approach. It wasn't about identifying a bacteria or a virus back then. It was about mapping the patient's complete experience in minute detail onto a known remedy picture.
It really does feel like looking through a window into a different way of thinking about illness. The sheer effort involved in cataloging all this, it's like building this enormous, intricate database of human symptoms, one observation at a time.
It really is. And that maybe leads to a question for you listening to this. How do these incredibly detailed, sometimes really peculiar symptom descriptions from the past, how do they make you think about health and observation today? Even if we don't use Cinnabaris for these things now, what can we maybe learn from this lost art of intense observation that these historical texts showcase?
Something to definitely think about. Thank you for joining us on this deep dive into Boericke, Cinnabaris, and a fascinating slice of medical history. Keep exploring those connections between history, science, and the human body.